What is cholesterol? Before we begin, please subscribe to our channel for more awesome health tips. So, cholesterol is a waxy, fat-like substance classified as a sterile subgroup of steroids that is essential for the body. Found in every cell, it plays a crucial role in maintaining cell membrane structure, producing hormones like estrogen and testosterone, creating vitamin D, and forming bile acids for fat digestion. Despite its negative reputation, cholesterol is not inherently bad and is vital for human health. Sources of cholesterol: the body produces most of its cholesterol primarily in the liver, counting for around 75 to 80% of total cholesterol. The rest comes from dietary sources, especially animal-based foods like meat, eggs, and dairy. While dietary cholesterol does influence blood cholesterol levels in some people, for most individuals, saturated fat and trans fats have a greater impact on blood lipid profiles than dietary cholesterol itself. Types of cholesterol. Cholesterol travels through the bloodstream inside particles called lipoproteins. The main types are low-density lipoprotein, often labeled bad cholesterol, because high levels can lead to arterial plaque buildup. High-density lipoprotein, called good cholesterol because it helps remove excess cholesterol from the bloodstream. Very low-density lipoprotein, which carries triglycerides and can also contribute to plaque formation. And intermediate-density lipoprotein, a transitional form between VLDL and LDL. Functions of cholesterol. Cholesterol serves several essential functions. It is a key structural component of cell membranes, helping them maintain proper fluidity and flexibility. It is the precursor to steroid hormones like cortisol, aldosterone, estrogen, and testosterone. In the liver, cholesterol is converted into bile acids that assist in the digestion and absorption of fats. Additionally, cholesterol in the skin helps produce vitamin D when exposed to sunlight, which is vital for calcium metabolism and bone health. Cholesterol transport. Cholesterol is not water-soluble and cannot travel freely in the bloodstream. Instead, it is transported by lipoproteins, complex particles that carry lipids and proteins. These include LDL, HDL, VLDL, and IDL. Each type differs in size, density, and function. The liver manages cholesterol transport and distribution. Spushing it reaches cells that need it while removing excess amounts when possible. Metabolism of cholesterol. The liver is the central organ responsible for cholesterol metabolism. It synthesizes cholesterol, incorporates it into lipoproteins, and converts it into bile acids. After bile aids in digestion, much of it is reabsorbed in the intestines and recycled back to the liver in a process called enterohepatic circulation. This efficient recycling helps regulate cholesterol balance, but can also contribute to elevated cholesterol if this system becomes imbalanced. Causes of high cholesterol. Multiple factors influence cholesterol levels. Diets high in saturated fats, trans fats, and refined sugars can raise LDL and triglycerides. Genetic conditions like familial hypercholesterolemia lead to extremely high LDL levels, even in young people. Other contributors include sedentary lifestyles, obesity, smoking, excessive alcohol intake, and chronic conditions like diabetes, kidney disease, and hypothyroidism, all of which can disrupt normal lipid metabolism. Cholesterol and heart disease. Elevated LDL cholesterol is a known risk factor for atherosclerosis, a condition where fatty deposits build up in arteries, leading to reduced blood flow, heart attacks, strokes, and peripheral artery disease. However, it's not just the total amount of LDL that matters small. Dense LDL particles are more dangerous than large, buoyant ones. Additionally, chronic inflammation plays a key role in plaque formation and rupture, highlighting the need to look beyond cholesterol alone in assessing cardiovascular risk. Testing for cholesterol. Blood tests called lipid panels measure cholesterol levels and include total cholesterol, LDL, HDL, and triglycerides. Ideal levels are generally defined as total cholesterol below 200 milligrams, DL, LDL below 100 milligrams, DL, HDL above 60 milligrams, DL, and triglycerides under 150 mg DL. These targets can vary depending on a person's overall cardiovascular risk. Some advanced tests also assess LDL particle size and number for a more nuanced risk profile. Cholesterol and inflammation. Newer research has shifted focus from cholesterol alone to the role of systemic inflammation in cardiovascular disease. Markers like C-reactive protein are being used to assess inflammation in the body. People with normal LDL but high CRP levels may still be at significant risk of heart disease, indicating that inflammation may play a central role in atherosclerosis's development and cardiovascular events. Medications for cholesterol. Statins are the most widely prescribed drugs for lowering LDL cholesterol and are also known to reduce inflammation. Other medications include ezetimibe, which reduces cholesterol absorption in the intestines, PCSK9 inhibitors, which significantly lower LDL in people who can't tolerate statins, bile acid sequestrants, fibrates for triglyceride management, and niacin, which can improve HDL but is now less commonly used due to side effects. Natural ways to lower cholesterol. Lifestyle modifications are often the first line of defense. A heart-healthy diet rich in soluble fiber, plant sterols, nuts, and omega-3 fatty acids helps reduce LDL. Physical activity raises HDL and lowers triglycerides. Losing excess weight, especially abdominal fat, improves cholesterol levels. Avoiding smoking and limiting alcohol also benefit cardiovascular health. Myths and facts. Common myths include the belief that eggs raise cholesterol dangerously, that all cholesterol is bad, and that only overweight people have high cholesterol. Many also wrongly assume medication is the only solution, when lifestyle changes can be highly effective. In fact, children and young adults can also be affected, especially with poor diet and inactivity. Special populations. Cholesterol management may vary by group. Women tend to have higher HDL due to estrogen, but cholesterol often rises after menopause. In older adults, very low cholesterol levels may correlate with frailty or cognitive decline. Children and teens can develop early cholesterol problems, particularly with obesity or family history of high cholesterol, making early screening and healthy habits important from a young age. Emerging views. Some scientists argue for more advanced assessments of cardiovascular risk beyond just LDL numbers. These include particle size and number, oxidized LDL, and inflammatory markers like CRP. Functional medicine approaches explore root causes such as insulin resistance, gut health, and chronic inflammation. Personalized medicine is gradually changing how cholesterol and heart disease are evaluated and treated. Conclusion: cholesterol is an essential molecule with complex roles in health and disease. While excess LDL and poor lifestyle choices can increase cardiovascular risk, cholesterol itself is not the enemy. The key is understanding its function, measuring it accurately, and managing it holistically through balanced nutrition, exercise, medical care when needed, and personalized risk assessment. Instead of fearing cholesterol, we should aim to maintain a healthy balance that supports overall wellness. If you think this video is helpful, pass it on to a friend who could really use it.